Welcome to HealthConnectPro Patients Module Tutorial. This is a part of a series of tutorials of the integrated modules of HealthConnectPro. HealthConnectPro offers solutions to the most common problems of home healthcare agencies. Our cloud-based software solution is an integration of the different modules you can use to streamline the various processes of your agency to work more efficiently, timely, in compliance, without losing focus on our main goal, which is to provide the best possible care to our patients. HealthConnectPro allows you to manage internal and external patient referral sources, patient intake process, start of care and plan of care documentation, orders management, multidisciplinary care delivery and scheduling, other agency operations such as billing and payroll, employee compliance, and meaningful reports that lets you see both detailed and overviews of the performance and financial aspects of your agency. In this tutorial, we will learn how to navigate and use the patient's list page, including how to search for a patient, view patient details, use the available filters, know the meaning of each patient's status, and know census of your agency. You will also learn how to print a report and create reports in a spreadsheet. Not all employees have access to this module. Please refer to your system administrator to verify your role and access in HealthConnectPro. You will begin by clicking on the HealthConnect icon from your desktop to launch HealthConnectPro. Log in using your pre-assigned credentials. This brings you to the landing page of the system. At the top portion, you will see the different integrated modules of HealthConnect. My Day, Admin, Clinicals, Finance, HR, Marketing System, and the Live Chat module. There will be separate tutorials for each of the modules. For today, we will focus on the Patients module. Click on the patient icon to begin. In the Patients module, you will find a list of patients referred to your agency with different statuses. This is where intake staff add patients into the system to begin the course of admission of the patients by the agency. The default list shows all patients without any filters. The top portion, as previously mentioned, is the menu of the different modules of the system. You will have easy access to this menu anywhere in the system. To the right of the menu is the agency's current census. This means we have this number of patients currently active in the system. To the far right is the login and exit icons. Click on the login icon to switch to a different agency using a different set of credentials. Click on the exit button to close the whole system. To search for a patient in the system, use the search option here. Type in first or last name and click the search button. The list will populate according to your search parameter. For example, we are looking for a patient with the first name of Marjorie. Type in Marjorie in search field and click the search button. You will find in the table a list of patients with first name of Marjorie, regardless of patient status. Here's another example of searching for a patient, this time with the use of the filter options. Type David in the search field. Now, David, as we know, can be a first name or a last name, as shown in the search results. The search returned 23 records of patients with David as their first name or last name. We can further filter this down to what we exactly need to find. Let's say we are looking for a patient David from a specific episode date range. Type in the episode date range that you wish to see. The list will automatically populate and show only patients that have episodes touching the date range you specified. You may also filter the dates by clicking the This Month button, 60 Days button, or Show All. Click the Clear button to clear your search parameters and filters. This will result to the default parameters, which will list all patients regardless of status. Other filter options available are in this section. The patient status filter includes Show All, which is the default value, meaning the list shows all patients regardless of dates and status. All Failed. This will show all failed admission regardless of dates and reason for failed status. All Pending shows all pending admissions for whatever reason. If you scroll down to the status drop-down options, you will see a more detailed filtration option. You can select Pending Docs for admissions with pending documentation, Pending Referral for admissions pending referral information, or Pending for all other reasons not specified. Failed Admitted to another agency shows failed admissions because patient is admitted to another home health agency. Failed No Clinician will show patients not admitted because of staffing issues. Failed No PCP will show patients not admitted because there is no primary care physician assigned. Failed Patient Declined will show a list of patients who declined home health care. Failed Insurance Not Contracted will show patients not admitted because of insurance issues. Failed Admitted to Hospital or Skilled Nursing Facility will show patients that have been hospitalized right after SOC. Or Failed. This will show failed admissions for all other reasons not specified. Possible SOC will show list of patient referrals that are awaiting verification and schedule for SOC. Admitted LUPA will show a list of patients that were admitted but has a LUPA episode. LUPA means Low Utilization Payment Adjustment. This means the number of visits provided to this patient did not meet the LUPA threshold set by Medicare. Episodes that fall under the LUPA threshold are not reimbursed in the same way as a standard episode. Rather than reimbursing a fixed amount, the LUPA episode is reimbursed on a per-visit basis. Admitted New Episode Started will show a list of patients that were admitted with a new episode start date. Admitted Hospitalized lists patients that are admitted but were hospitalized. Admitted will show patients that are admitted and currently receiving care from the agency. The next filter is the admit status of the patient. Click on the drop-down to select options. Do you want to see just the new patients or the recertified patients? Click on the agency drop-down if you are managing more than one agency. Use the insurance filter if you want to see just the list of patients with a specific insurance. Want to see how many patient referrals a specific community liaison referred? Use the community liaison drop-down to filter your patient list by community liaison. Active status filter is used when you wish to see a list of active patients only. Select Inactive to view a list of discharged patients. Click on the Show Anticipated EOE Today button. This will show a list of patients whose episodes are ending today. Another thing to take note of, which may be useful to you, is every time the list updates, the record count here in the lower left also updates. Now that you know how to use search for a patient and using the different filters, let's now dive into the actual search results table. So, you found your patient or list of patients. What can you do with this list? In this table, you will find the patients based on your search parameters or filters applied. Note that clicking on the title of each column automatically sorts the data alphabetically or numerically. Clicking on the title again reverses the previous sort. The CTR column is the control number of the patient. This is used by the system to uniquely identify each patient. Some would call it a medical record number or patient number. These are the last name, first name fields of the patients. The episode number column automatically populates when a patient is recertified, however many times. The recert column signifies if the episode selected is a recertification episode. Recert episodes will have a check mark on this column. SOC date is the date that the start of care was completed. Episode date is the start of the episode. Anticipated EOE is 60 days after the start of episode date. Actual EOE is the actual date the patient was discharged. Status column shows the current status of the patient on the selected episode. This field must always be updated to get accurate reports. Active columns will show a check mark if the patient is active in admitted status. Insurance column indicates the insurance of the patient being used for this episode. Community liaison indicates the name of the liaison or marketer responsible for bringing in the patient into the agency. External referral source indicates the external referral source where the patient came from. Exported to software is an add-on option if your agency purchased the software export feature. If you wish to update a patient's status, select the name of the patient and click Details. This opens the patient details and you can update the patient's status here. Don't forget to save the patient details page and click Close to go back to the previous page. If you wish to add a patient, click on the Add button here. There is a separate tutorial on the intake process. You'll find a link to this at the end of this session. If a patient is being recertified, click on the Recertify button here. Note that the Recertify button is not available or grayed out until it is 5 days before the anticipated end of episode. When you click the Recertify button, a pop-up notification will appear reminding you that this action will create a recert period for the selected patient. Click Yes to continue or No to go back to the previous screen. The Print button down here allows you to print a selected patient's face sheet, or select all patient and use the filters if you want to print a report. You can print by SOC date range or this month, this year, and show all. You can also create a report by create date or referral date. You can also filter the report to be printed by patient status, agency, insurance, or patient's admit status. Click Print to generate a PDF file to print. Reset if you want to clear filters and start over. Click Close to go back to the previous screen. The Export to Excel button likewise has filters that you can use to create a report on a spreadsheet. You can filter by referral date range, SOC date range, anticipated EOE date range, and create dates. Other filters in the Export to Excel feature includes patient status, insurance, agency, external source, and by marketer or community liaison. Mark the checkboxes of the information you wish to be included in the report. Click Export to download an Excel file. The totals at the bottom of the screen shows a quick glance totals for the agency. You will see total for new admission, total for recertify, total pending admission, and total failed admission. This portion shows which user created the patient file into the system, including date and time. When a patient record or episode is updated, this portion shows who updated the records. The Close button at the bottom right of the screen closes the patient module. You have now learned how to search for a patient, view patient details, use the available filters, know the meaning of each patient status, and know census of your agency. You also have learned how to print and export reports. This concludes our tutorial on using and navigating the patient module. Thank you for using HealthConnectPro.